Welcome to my channel, Doctorology. Today's topic is ACL tear. ACL, that is anterior cruciate ligament. It is a tough band of fibrous tissue which connects bone together. One of the four major ligaments of knee among ACL, PCL, MCL, and LCL. It is the most injured ligament in the knee, included in the lateral compartment of knee. Origin of anterior cruciate ligament is from medial wall of lateral femoral condyle and inserts into middle of intercondylar area. It has two bundles, anterior-medial and posterior-lateral. Anterior-medial provides 85% of restraining force to anterior tibial displacement in 90 degree of flexion, and posterior-lateral bundle provides varus and valgus stability in full extension. One thing to keep note on that cruciate ligaments are extrasynovial, while collateral ligaments are intrasynovial ligaments. ACL prevents excess anterior tibial translation. Now, how ACL is injured? Mechanism of injury can be contact and non-contact both. 1. Slight knee flexion with tibial external rotation at foot strike or sudden deceleration. Next, landing from jump incorrectly. Flexion or hyperextension or hyperflexion combined with internal rotation. Twisting force on semiflex knee or pivoting or direct collision, that is football tackle. ACL injury is most commonly found in female athletes than male. Incidence is 2.4 to 9.7 times higher. Grading. Grade can be 1, 2 and 3 depend upon the injured ligament. As any other ligament injury, it is also same. Grade 1 is slightly stressed, that is no instability but slight tenderness is present. Grade 2 has partial tears and grade 3 has complete tears with lot of swelling and instability present. Symptoms is popping sound at the time of injuries. Patient will complain that when I have approached with that injured activity, a popping sound is heard. Feeling of give way of knee. Patient may fall on ground and discomfort while walking. Signs. What can be the signs? Tenderness, swelling within 24 hours, and loss of full ROM. On physical examination, we will confirm by doing three tests: anterior draw test, latchman test, and pivot shift test. Other investigation can be done by MRI, which is gold standard. Management of ACL tear can be in three ways: first medical, second conservative, and third surgical. Among all three, first foremost important thing is price, that is protection, rest, ice compression, and elevation to the injured limb. And under medications, painkiller can be provided. Conservative treatment is for grade 1 and 2 tears and also for grade 3 tears post operatively. Surgical reconstruction can be done in three ways: by autograft, allograft, or artificial graft or xenograft. Autograft can be taken from patellar tendon pieces, hamstring, or quad tendons. Allograft can be cadaveric, and artificial and xenograft from non-animal sources. One important thing to remember: when ACL is injured in combination with medial collateral ligament plus medial meniscus, then it is called as O'Donoghue triad. As we can appreciate in this diagram, this is a lower distal end of femur, upper proximal end of tibia with meniscus in between. This is ACL and this is PCL. Lateral collateral ligaments and patella with patellar tendon, quadriceps tendon, and this is head of fibula. This is articular cartilage. In this diagram also you can appreciate that ACL and PCLs are extrasynovial ligament. Now I will be telling you about one trick to remember ACL and its insertion from apex. In apex, A denotes ACL, P denotes posterior, and X is lateral condyle. That is, ACL runs posteriorly and insert on lateral condyle of femur. And also, when we cross two fingers of ipsilateral hands like this, then anterior finger will be representing ACL and the posterior finger will be representing PCL. By this manner we can remember the ACL insertion.